Cholesterol. Today we're talking about cholesterol because it is one of the controllable risk factors that we know causes heart disease. What is cholesterol and is it good or bad? Cholesterol is a fatty substance. It is something that we must have. It is made in the liver. So if we have too much cholesterol, then it causes a plaque buildup. Comes from a family history, so it is proven fact that if you have a family history of high cholesterol, you are more prone to have that heredity gene sometime in your life. It also comes from our foods, and it comes from dairy and animal products. So that's when we ask you to watch your cholesterol count in the foods that you eat, since we already have it in our body. What this model shows is what a cholesterol buildup is. Right here is a normal heart artery, and as you see through it, there is a plaque buildup, and this one is when you are getting stented or bypassed because of too much plaque or cholesterol buildup. You all have your cholesterol numbers in front of you of your most recent cholesterol numbers. And depending on what your cholesterol numbers show, depends if we will redraw you just prior to graduation. And we will let you know as that gets closer. So if it's really high right now, we will let you know if your doctor doesn't order it prior when you will redraw. But if we don't ask you to redraw, you will know that your numbers are within the limits that we want. But now I'm going to break it down so you understand what the numbers are and what's good and what's bad. Your total cholesterol by American Heart Association needs to be below 200. That is to prevent heart disease. And once we know someone does have heart disease, they want that at 180 or below. Triglycerides. Triglycerides, we want that level below 150. And that can be a family heredity also if that is up. And also people that are alcoholics or definitely drink over a moderate level, their triglycerides will be very high. Also, an out-of-control diabetic will have high triglycerides, and I'll talk about that down the road a little further. Now, there is two numbers that we look at, the HDL and the LDL, and everyone seems to have a hard time remembering of which one's the good cholesterol, which one's the bad cholesterol, and I myself have had a hard time. So what I was taught is HDL is your happy cholesterol, and that's the one that we want higher. That's the one that protects our heart. Men, their HDL needs to be above 40. Women need to be above 50. The LDL, that's the bad cholesterol, and how I was taught to remember that is LDL, meaning the lousy cholesterol, and that is the one that causes the heart disease. American Heart Association wants that number below 100, and if someone's diabetic, the goal is to be 70. A few years ago, the American College of Cardiologists also started doing some research, and so I just gave numbers for American Heart Association of that LDL being below 100, but the American College of Cardiologists, what they have found through their research, and I'm going to make this an even number to make it more understandable, is if your LDL, your bad cholesterol, is 300, and after your cardiologist puts you on your cholesterol medication, the goal is not necessarily to get that to 100 or even at 70. What they have found, you decrease your risk if you cut that number by 50%. So if you get that 300 to a 150, even though that's outside the limits of American Heart Association, it definitely decreases your chances of further heart problems in the future. So I like you to understand there are two different standards that we practice by on that due to the research of American Heart as well as the American College of Cardiologists. How the cholesterol causes problem is by building up that plaque. And back in the 80s, you would hear of hardening of the arteries, and that's what basically it does. You just don't hear that term very much anymore. Now, what we teach you is about cholesterol is it's not all about just teaching you. I'm going to stop at that for a minute. We teach you to read the labels on cholesterol. The dietitian talks to you specifically about fat intake when she does her class on fat. I talk about your labels through this class because to lower your cholesterol, it's not only looking at your label saying how much cholesterol is in that food product, but it is also looking at your fat content. Since cholesterol is in our body, since it's made by the liver, and you might have a family history, and we get it from the foods we eat, such as meat products and dairy products, you do have to look at the label. You are only allowed, or we are only allowed, less than 300 milligrams of cholesterol in food a day to control your cholesterol. So that's when you look at your food label and see, is there any cholesterol in the food product? And in your handout, you will see that the label that's there is 0 cholesterol. But then you have to look at your fat content. And your fat content on a product may be 14 grams of fat. So now we have to break down the fat content. Is it a good fat or is it a bad fat? Saturated is your bad fat, and that comes from your meat and dairy products. Most of us do obviously eat meat. We're not vegetarians, so that's where the beef comes in, that we ask you to limit your beef to only 2 to 3 times a week, because beef is the fattiest meat out there. And we ask, that is a smaller serving size. Fish and chicken, a normal serving size is 6 ounces, but when you eat beef, it is only 4 ounces. And 4 ounces is the size of a woman's palm, or the size of a deck of cards and the thickness of a deck of cards. Now, what I like to explain on that is, that doesn't mean you can't ever have an 8-ounce Kansas City strip or a 10-ounce T-bone. But no, you cannot do that 3 times a week every time, because that is too much beef. But if you treated yourself here and there with that amount of beef, that is okay. That's also why in the dairy products we ask you go to low fat or no fat products. Now when we talk about dairy products, I specifically zoom in on milk, and as heart patients we ask patients to do skim milk or 1% milk. But over my years of working with cardiac patients, most patients say, I won't do anything less than 2% milk. And so I tell you that's fine. You can continue your 2% milk because not everybody's going to be perfect. But on other dairy products, such as your yogurt, your sour cream, your cottage cheese, you want to do the no fat or the low fat in those products. And on cheeses, you do your white cheeses more frequently than your orange cheeses, because the orange cheeses are have more of a fat content. So that's what your saturated fat is. So you want that fat as a lower fat, because that's where all the bad cholesterol comes from. Unsaturated fat is your good fat, but when you look at your food label under unsaturated fat, that's broken down into monounsaturated and polyunsaturated. Mono means one, poly means many. On your handout, you will see that there is like 10 polyunsaturated and 3 monounsaturated. Well, for that to be a more heart healthy food, you would want those 2 numbers switched. You would want your poly to be 3 and your mono to be 10. And why that is poly meaning many. What's been proven through research is if you take in too many polyunsaturated fats on a regular basis, it decreases your good cholesterol or your HDL, and that's the number that we want up. On the trans fat, that's always the question of trans fat. Trans fat is anything in a package or when you eat out at a restaurant or fast food. So on trans fats, to give you an example, is I've had cardiac patients in the past, and I've been in educating that cardiac patient, and the cardiologist makes rounds, and the patient says, does this mean I can't ever eat at Wendy's? I have to have my hamburger once a week. And the cardiologist would laugh and say, no, that's fine to eat that once a week, but you can't eat it 2, 3, 4, 5 times a week because that's too much trans fat. Basically, this is where the saying comes from cardiologists or heart surgeons: if it tastes good or it doesn't fly or swim, don't eat it. That's why we tell you turkey, fish, chicken, because beef doesn't fly or swim. So that's where you will hear that saying. Now, back to the trans fat. On trans fat, I always use Tostitos as an example. I think Tostitos doesn't do it as often anymore, but Tostitos, when trans fat first was getting talked about, they would put across their bag 0 trans fat. Well, that's not absolutely the truth. And the reason they're allowed to put no trans fat on their bag is because anything that has 0.5 milligrams or less of trans fat in it, it is legal to put no trans fat. But anything in a box or a sack has trans fat in it because they have to add preservative for shelf life. So how you know if something really has trans fat in it is then you look at the ingredient label, and if you find the word hydrogenated or partially hydrogenated, you know there's trans fat in it. And we need to limit how much trans fat there is. So now I'm going to give you an example. The first example I'm going to show you, this is a mono unsaturated. And as you see, it's nice and slick and it slides right through the vessels. This is the healthier unsaturated, mono unsaturated. And when you look at your handout, you will see a list of the healthy mono unsaturated, which the 2 main ones that we teach you to use when you're cooking is the canola oil or olive oil. We do ask you not to fry foods too much, but if you are going to fry, you want to use your olive or canola oil, but oils have a lot of calories, so even if that is a healthier oil, there's a lot of calories in oil, and so that's why you have to watch fried foods even when using a healthy oil. Now this next fat is a saturated fat, and I'm going to hold this one up with a trans fat so you can see the difference on how big the good old blob of fat is. If you ate too many saturated fats, here in my left hand, that's too many animal products or dairy products. And this is trans fat of eating out too much at restaurants or fast foods or too many things that are in boxes and sacks. The reason we all like to eat out at restaurants is because food tastes good. Well, the food tastes good because most restaurants do not cook heart healthy, and so if you ate too much saturated fats and too much trans fat and you put those 2 blobs together, you can now see how this blocks up the heart arteries and causes you to end up with stents or potential bypass. Now, my last example is this is a jar that is dated October 7th of 2009, and the nurse that worked here prior to me put this in here, and I have not opened the jar, but I always ask people, does anyone know what's in this jar? And I like people to discuss around and say what it is and get ideas of what you think it looks like and what you think it is. The number one thing that people say this is green beans, which I see how they look at it, but what is in this jar is anyone that has come to Truman any length of time remembers up to about 2.5, 3 years ago, we had a McDonald's downstairs. These are McDonald's French fries that have been in this jar since October of 2009. And the purpose that the nurse put this in here is to show that since 2009, these French fries have not changed, except they have darkened in color to show you that too much trans fat does not break down in your heart vessels like these French fries. And I am one that likes McDonald's French fries, but you can't eat them too much because this is what happens, is they do not break down in your vessels and it will cause heart disease. So that was to give you a visual of all the different fats and what happens to your arteries when too much cholesterol is there. Now, LDL is your bad cholesterol, so how do we lower that LDL? Well, one thing that lowers your LDL is exercise, minimally 3 to 6 times a week, 30 to 60 minutes a day. Obviously, watching your fat intake in your body, in your food, so reading those labels and looking at them and watching that daily. Taking in less than 300 milligrams of cholesterol in your diet in one day. Now the next big controversy that you see out there, and there's still controversy, which is going to affect your LDL, is butter or margarine more healthy? And everyone has their own take on which one is more healthy. Well, if you're unsure of what's more healthy, the fact is butter is truly more healthy. But the problem with that is that we are Americans. We Americans are very spoiled because of what we have out there and available to us. And you will learn through the dietitian class that a normal serving of butter is the top of your thumbnail. And if you think about having a baked potato, most of us will not just put that very tiny amount of butter on. So that's why we teach heart patients you need to use the margarine, and we teach you to lean towards the Promise or I Can't Believe It's Butter, and there's some other products, Smart Balances out there. Those are all good because those are the heart healthy and they don't have cholesterol in them. The next thing on cholesterol, as well as being a heart patient, you must increase your fiber. And fiber comes from fruits and vegetables. And while it was summertime, we could get fresh fruits and vegetables. But the other next best of the fresh is using frozen. If you use the canned fruits or vegetables, on the fruits, you need to make sure it's in its own juice and not in syrup. The syrup is not a healthy thing. So if it's in its own juice, that's better. But as far as the vegetables, you want to make sure it's low sodium or no salt added in the can. And yes, you can drain the can and then rinse it off, but they still can have some sodium on it. So we prefer you to get the no salt added because of the sodium intake that's in those canned vegetables, or use the frozen. Other things that are good in fiber besides your fruits and vegetables is beans, lentils. Are heart healthy, and we want you to lean towards wheat pasta, brown rices, whole wheat, or whole grains on your breads. On the pastas and rices, a lot of people say they don't like it because it does need an acquired taste, but you want to make sure you do increase that fiber. Some other good heart healthy things you can eat or snack on that are high in fiber is popcorn, the little snack microwave sacks, but you have to watch what you put on that popcorn. The salt is unhealthy, and then of course the added butter and things. So you don't want to add all of that then makes a nice snack and heart healthy more unhealthy. Nuts are another thing. Fiber will protect your heart, so that's why we want that up. And nuts are heart healthy, but not macadamians or the cashews. And those are usually everyone's favorite nuts, but those are the bad fats. And so we want to lean towards the pecans, the walnuts, or the almonds. You can do peanuts, but not the salted ones. So those are all heart healthy fiber things. The other things that affect your cholesterol numbers are if you smoke. Smoking will decrease your HDL or your good cholesterol. When a smoker stops smoking, it's amazing when we draw their blood later that HDL has come up, their LDL has come down. So smoking definitely affects. Losing weight definitely affects your numbers, triglyceride numbers, as well as your HDL and LDL. So we want to make sure that you we want to make sure if you need to lose weight that you do lose weight and you will see your numbers move. So continuing to exercise and doing that you'll see movement in your numbers. Now triglycerides, I said that we would talk about because it comes from too much alcohol or an out of control diabetic. When people's diabetes is all out of control, you are sweet with inside because your sugar is very high. Alcohol is total sugar, and when people abuse alcohol, it is nothing for us to see triglyceride levels in the 3,000s and 4,000s. But when someone stops drinking and they're not abusing alcohol any longer, we will see that triglyceride number drop in the 200s or 300s. And even though that's still high, that is very good for them, and especially if they have a family history. So the triglycerides do come from the food you eat as well as the alcohol, and exercise will help those numbers. The only thing I'll say about your cholesterol medications, because the pharmacist does talk about them, is yes, they are medications that lower your numbers and get you to the numbers where we would like to see you to decrease your chance of heart disease. But one thing I've experienced with heart patients is when your numbers get normal and we tell you your cholesterol numbers are great, then I've watched heart patients stop your cholesterol medications. That is a big no-no. These medications are for other reasons. Not only do they move your numbers and get your numbers more normal, but we have patients that don't even have a cholesterol number and you are put on cholesterol medications, because what has been found through research with the cholesterol medications is that they are secondary prevention medications to decrease the plaque buildup in your arteries. And a heart attack happens two ways. You're either someone that throws a blood clot to the heart, or you build up the plaque. And plaque can soften in your arteries, and if it softens, it can break off and go downhill and cause a heart attack. And what these cholesterol medications do is help stabilize that plaque buildup so it hopefully does not break off and go downhill. These medications also have an anti-inflammatory effect that can cause chest discomfort and spasms within these vessels. So you take these medications, and if you end up with side effects of them, muscle cramping is the number one side effect that we see, especially in Lipitor. If you let us know about that, we talk to the doctor, and if they feel that you are having a side effect of that, they'll stop your Lipitor, move you off to one of the other medications that will do just the same and won't cause a biggest percentage of the muscle cramping. So these medications do go on lifelong as a secondary prevention medications.